Hi, this is student Dr. Shannon with YPN's Guide to DOing Med School. Today I'm going to be showing you the basics of cardiac auscultation. When performing cardiac auscultation, it's important that the chest is properly exposed so landmarks are easy to identify. For a basic cardiac exam, we listen to four main areas named after the valves they best represent. These include the aortic, pulmonic, tricuspid, and mitral valves. Before listening, make sure your stethoscope is positioned correctly. The earpieces should be angled forward towards your nose. You can gently tap on the stethoscope to confirm which side is active before auscultating. We'll begin by listening at the aortic valve, located at the right second intercostal space along the sternal border. Next, we'll move to the pulmonic valve area, which is located at the left second intercostal space. We'll move down to the tricuspid valve, which is located along the left sternal border as well at the third intercostal space. And finally, we'll move down to the mitral valve, also called the apex, which is located at the left fifth intercostal space along the midclavicular line.